Kenyans have been cautioned against misuse and overuse of over-the-counter antibiotics to help reverse the rising trend in the prevalence of antimicrobial resistance in the country. Stakeholders in the health sector say the fight against the resistance has long been overlooked, a situation that continues to endanger the lives of Kenyans. Led by infectious disease specialist at University of Nairobi, Dr. Lois Ombajo, the stakeholders are now calling on the government to urgently intervene in raising public awareness on measures to curb the menace. Now, according to Dr. Ombajo, antimicrobial resistance normally occurs when viruses, fungi, parasites and bacteria fail to respond to antimicrobial medicines. The stakeholders spoke during the launch of World AMR Awareness Week in Nairobi.
To pick antibiotics. If you're sick and you take antibiotics that have been left over, if you don't finish your doses of antibiotics, then you're placing yourself at risk of having bacteria that are resistant to antibiotics, which means the day you get sick and you really need an antibiotic, we can't find an antibiotic that will work for you. Stop picking antibiotics over the counter and just taking without having a proper diagnosis and knowing that we truly require the antibiotics.
We run the risk of having infections that are not treatable, having healthcare costs that are spiraling, and even increased rates of mortality across the population.
Use vaccination as a mode of preventing diseases, because it's these diseases that encourage people to use antibiotics. So in order for us to minimize the use of antibiotics, let's try and avoid the infections by promoting infection prevention control measures.